Good day, global citizens. Welcome to another episode of Dr. Fajembola's Opinion. Thank you for joining us through other episodes of Dr. Fajembola Opinion. I see your comments, I see your likes, and we will need more feedback on what we are doing on this platform. Please join me to welcome Miss Azugo Nwa Dioto Okunero.
Yes.
I hope I pronounce your name. I so much love traditional names, and I'm
Thank
so happy
you.
I'll be calling you Miss Azugo. She insisted I should call her Miss Azugo. She's a doctoral student, but let's keep it.
The good work you're doing in terms of putting out research works out there with alternative means of communication to get to the wider public, especially those
Thank
who
you
are
so
not
much.
in the academy. So thank you
Thank
very
you so
much
much.
again. I wanted to river blindness, soil transmitted helminthiasis, schistosomiasis, biliary ulcer, and so on and so forth. There are over 20 of them, about 19 to 20 of them. And all of them are lumped under this umbrella of neglected tropical disease. So this already is in itself a disadvantage or a problem, so to speak, as to why this disease is neglected. Now, schistosomiasis is further divided into intestinal and urogenital schistosomiasis.
36 states in Nigeria, and why? Because I know sometimes you can paste these public health pictures across the states and even cross country. So can you paste across other states in Nigeria?
I'd say no. No, it cannot necessarily be applied to all 36 states of the country for several reasons. One of them being that there are varying environmental conditions. There has to be the presence of freshwater bodies like streams and ponds and rivers and lakes. There has to be the snail parasites, which is the intermediate host of the parasites. That means the host of the parasites in which the parasite has to reach a certain level of maturity before getting to sexual maturity. It has to be present. Again, socioeconomic conditions also contribute. You see, for instance, which is a very good example that I had to learn with State Nigeria. As at 2019, Rivers State was mapped out as one of the 8 most endemic states in Nigeria by a study from Eze et al. 2019. But currently, Rivers State is no longer endemic, or they have brought schistosomiasis to a certain level of control. And this is because of practices like water, sanitation, and hygiene, local health interventions, providing water sources in schools to prevent children and communities to prevent people from having contact with water bodies. And of course, like I mentioned, the environmental conditions. So it cannot necessarily be placed across all 36 states, particularly urogenital schistosomiasis. Maybe other forms of schistosomiasis like the intestinal, but particularly urogenital schistosomiasis cannot necessarily be placed across all 36 states. So no, I would say no, that it cannot be pasted across all 36 states. Just specific regions with suitable environmental conditions, suitable socioeconomic factors, lack of amenities, poor access routes, prone to flooding, even prone to conflict. These areas, yes, are susceptible.
Okay, thank you so much for that, Ms. Azugo. Our audience, only Nigerian audience, can get a picture of what it takes to have schistosomiasis and the areas most affected by schistosomiasis. Moving forward, Ms. Azugo, why are school children and adolescents the main patients? Because from your discussion, I see that these are the main patients. Why are they the main patients?
Yes, so because they're often at higher risks. It's not just school children and adolescents, women and even adults, but particularly school children and adolescents are at a higher risk of infection because they have to constantly and frequently come in contact with freshwater bodies. I mean, go to our villages. Whenever you're passing through a village stream or something, it's always the kids. Are you there? Yes,
Yes,
when you're
yes.
passing through a village or something, it's always the kids who are jumping into the water, playing and swimming, and so on and so forth. And well, I would say unfortunately, because when you now look at the current economic landscape of our country, some of these children are becoming breadwinners.